What are the most common shoulder conditions that you and your team treat?
Shoulder rotator cuff sprains and strains or tendinopathies, impingement syndrome, frozen shoulder, arthritis, or bursitis.
Can chiropractic adjustments reduce shoulder pain?
Well, it's not only the shoulder that could be the root cause, it could be coming from your neck or your thoracic spine or some part of your scapular plane. Adjustments for the cervical spine or the thoracic spine do help with cervical thoracic mobility, which is attached to your scapular and shoulder girdle. So basically, if the neck or the middle back is not moving the way it should, adjustments will help open the spine up, create more mobility so that the shoulder is not compensating anymore. Due to the compensation that the shoulder had, that can lead to the injuries like mentioned before, like the shoulder sprains and strains, the tendonitis. It's not just working right. So that's why chiropractic adjustments are really great for also shoulder issues, because when we unlock the neck and the spine, we give the shoulder better posture, body mechanics, things like that to do its proper function. What causes like sprains and strains or tendonitis is usually due to like the overuse or the misuse of the joint.
So typically, what causes shoulder pain for your patients?
If the neck and back is very stiff due to some kind of postural syndrome, or if you're like on the computer all day working and you're not really moving throughout the day, then that can lock up. And then if you're trying to do something with your shoulder, like overhead sports or any other day-to-day activities, the shoulder might be overcompensating due to the lack of mobility in the neck and the middle back.
So how do you determine what treatments will be most effective for each person?
We first identify what's causing the pain. Like they'll tell me like what makes it feel better, what makes it feel worse, what aggravates it. Then we do like a range of motion test screening. We check flexion, extension, internal, external rotation, and also abduction, and see where it hurts, what type of pain it is. So when we test those factors out and then couple with the orthopedic test, we can get a clearer picture on what might be going on with the shoulder, whether it's an overuse injury, whether if it's traumatic, they fell on it, or they just sprained it through playing a game, a sport, or whatever that might have happened. Or we just look at the history and see if there's more complicating factors like that that could cause frozen shoulder. So frozen shoulder test, which would show like the range of motion is restricted passive and actively. It's blocked. Or impingement is just only pain on the top. Or they only do certain movement that's only hurting there, then that could be just an isolated rotator cuff sprain, strain, or tendonitis too. It really depends on how when we couple the test together to see what the actual diagnosis is.
And what treatments do you typically use for those with shoulder pain?
I found that mild fascial release or manual therapy using like the massage gun, soft tissue techniques with instrument-assisted soft tissue mobilization, or like Graston is a trademark name, but like using tools to release the muscles, break down scar tissue, increase circulation, blood flow in the area. I found dry needling is really effective as well, because that uses monofilament needles, and we stick the needles inside the muscles or the tendons or whatever structures are being affected, causing the pain, and we stimulate, we stimulate blood in the area so it starts healing it as well. So that uses mechanical stimulation. We also couple with TENS unit for pain modulation as well as rehab, so we can get the shoulder either more mobility and range of motion and flexibility, or we stabilize it and make it stronger. The adjustments can also help with, there are two joints that the adjustments can help with the shoulder joint itself, whether it's an AC, the acromioclavicular joint, or it's the GH joint, the glenohumeral joint. So sometimes those get stuck too due to, again, compensatory factors, and we have ways to adjust that to provide more shoulder mobility.
And how long do patients need to be getting treatment with you and the Rockville team to recover from their shoulder pain?
It really depends. If this person has been dealing with pain for years and it's severely arthritic and frozen, then it's going to take some time for that. But if a patient recently injured it, like quickly, maybe from a sporting event, we can get the patient out of pain maybe 3 to 7 days. Maybe 2 to 3 treatments, we can start noticing decreases in pain. But it might take a few weeks of treatments to get the function back without re-aggravating the shoulder as well. But it depends. It could be if they hurt their shoulder from a severe sprain strain from a car accident, or if they tore it, God forbid, then it could take maybe a month or so. of consistent treatment.
Can you tell us a little bit more about each shoulder condition and what you do for it, such as shoulder bursitis?
Usually the subacromial bursitis, there's a bursa sac that lives under your acromion, subacromial bursitis, and that can get inflamed through overuse. So if someone does like overhead movements or sports, they're constantly abducting their shoulder and they're pinching it, that can cause this bursa sac to get inflamed and painful. So anytime that they do that again, you're just pushing on let's say a bruise or something that's really sore. So usually rest would be great for that, but also figuring out what mechanics cause that to be inflamed anyway. So like there could be a compensatory factor that cause you to do more abduction than needed, and that pissed that little bursa sac off, which was mainly to make sure that the bones are not like hitting each other.
So once the patients have recovered and their treatments are completed, how do you help patients prevent the shoulder pain from coming back?
By getting to know the patients, taking a thorough and proper history, doing a thorough exam to check out their body mechanics, movement, and like listening to the patient and knowing what they want to get back into doing. So we try to align our exam, our history, our treatment based on the patient goals to getting back to fully functioning without pain. And we also go into a wellness and supportive care plans too. So after they're discharged, we want to make sure that we keep tabs on them, that they are staying well, and if there's anything that comes up, we identify it early before it becomes an issue.